Welcome to PharmaLover's presentation on the challenge of affordability of new drugs. The question is, can we afford affordability or not? What would be the consequences if we did not make a cost-effective breakthrough intervention available or limit its application? On the other side, what would happen if cost-effective interventions were reimbursed without restrictions? This presentation shows a potential way to deal with this challenge. Since the gap between economic growth and rising healthcare costs opened, measures have been needed to promote sustainable healthcare. In recent decades, the potential in the off-patent market has been exploited under the motto "the same at an affordable price." Then, after generics had reached the plateau phase, the focus was on the patent-protected pharmaceutical market with the core question, value for money. Today, many established methods such as comparative effectiveness and cost-effectiveness as well as various value frameworks are available for the assessment of benefits and prices. It seems that this phase has now also reached a plateau. PharmaLover believes that the next decade will be dominated by the core issue of affordability. This is for the following reasons. First, low economic growth increases the pressure on healthcare spending. Second, long-term therapies can increasingly be replaced by groundbreaking innovative one-off therapies, which is associated with high initial treatment costs. And thirdly, fragmented personalized medicine leads to higher product prices. A cost-effective therapy is a good investment to consider, increased effectiveness at reasonable additional costs. Please look at the diagram on the right. Each year, new cost-effective therapies incur additional costs to varying extent, which add up over the years. At some point, the sum of cost-effective therapies would exceed the drug budget and must be funded at the expense of other direct medical services. At the very end, cost-effective therapies will compete with other social benefits such as education. In the chart on the left side, you can see that the number of PubMed publications has grown by about 22% for CE studies and about 70% for budget impact studies over the past 5 years. This shows that the importance of budget considerations is increasing. Affordability means a high impact on the budget and depends on the specific perspective, for example, payer or patient. In healthcare, a high budget impact can be caused in the short term by one-time high initial payments or over a longer period by the sum of cost-effective new therapies. Look at the right side. Affordability is limited when health resources are in strong competition with basic life expenses. Healthcare is kept to a minimum and the introduction of a new medical intervention can only be financed if another benefit is cancelled. This means that the opportunity costs are high. On the left, you can see the situation in a high-income country. Exceeding the budget can be managed by delisting poorly effective services or by reallocation of resources from other medical or non-medical budgets. Rapid market access for new cost-effective therapies is important. Treatment outcome and quality of life are usually improved as a result. Managed entry agreements make it possible to make new therapies affordable. Affordability always depends on the perspective or the payer. For example, patients, health insurers or public health care. Fortunately, there are already ways to improve affordability across categories. So, let me briefly comment on the main points of the 5 categories listed. Breakthrough. New hepatitis C treatments are very cost-effective and eliminate the virus almost completely. However, the simultaneous treatment of all affected patients would account for up to 50% of all drug costs in the short term. We are dealing with a funding problem. The main approach is to spread the costs over a period and allow for volume/price adjustment. Precision medicine. Today, more than 70% of all new cancer drugs are personalized. As a rule, a clinical test for one or more biomarkers is required at the same time. The clinical benefit and cost consequences may still be unclear. The approach is to establish the clinical treatment pathway and to develop evidence with real-world data. Cell and gene therapies. CAR-T is the combination of a product with a medical process that leads to a potential cure. The pricing of the product also depends on existing DRGs and codes. Single-use treatment with high prepayment and limited data poses the greatest challenge. The solution is pay for performance with annual installment payment. Orphan drugs. Return on investment needs to be distributed among a very small number of patients, which is why orphan drugs often exceed the accepted threshold of cost-effectiveness. Sustainable pricing of orphan drugs should increasingly be geared towards effect size, prevalence and ROI. Social drug. Alzheimer's disease has a very high burden of disease and drug therapies currently have only a limited effect. The special feature is that around 50% of the costs incurred are through the care of relatives and friends, and that the patient himself must bear the home costs himself as far as possible. More effective medicines could reduce private efforts and should be increasingly financed through the social sector to ensure a reduced private care level in the long term. In summary, PharmaLevers notes that drug pricing and reimbursement is becoming increasingly dependent on other medical services and, as a result, there is an increase in the need for cross-sectoral funding. Health does not depend solely on access to medical services. The labor market, education and social aspects also influence the state of health. As a result, rising healthcare costs cannot simply be financed at the expense of other social services and achievements. All patients should have equal access to medical services, regardless of the frequency of the disease. The urgency and severity of a disease should be considered. Pricing should be designed in such a way that medical services do not come at the expense of other social achievements. It is a key question in how the social perspective can be adequately considered in the pricing of medical services. Cross-sectoral valuation is not a new concept. The main problem is that benefits and payment obligations are not in line. If we question affordability, we should start from a holistic view. Let us look at the diagram on the left. More than 60% of Switzerland's gross domestic product comes from private consumption, and social benefits account for around 25%. If a new medicine provides benefits in these two main areas, for example through increased income or reduced care needs, the overrun of the budget in the health sector can be compensated at least in part. This effect is schematically represented in the diagram on the right. A new medicine increases the direct medical costs of a treatment by 50%. However, the patient can earn money faster and his care costs are reduced. In the end, there is only a moderate increase in costs for the new, effective medicine. Again, the concept is not new, but the increasing challenge of affordability requires its implementation. By default, the budget impact should be determined both from the payer's point of view and from a social point of view. Maybe, there should be a joint reimbursement decision of the health and economic sectors. In summary, PharmaLevers believes that we are entering the decade of affordability and that the following consequences will entail. In the time of personalized medicine as well as cell and gene therapies, reimbursement of new medicines will become increasingly dependent on other medical services, such as diagnostic tests, DRG and codes. This means that value assessment and financing should increasingly be cross-sectoral. At present, the prices of innovative therapies are soaring, especially for the treatment of rare diseases. All in all, we must ensure that this is not at the expense of social achievements. The good news is that we have enough instruments to ensure affordability.